I'm Dr. Vikram here. We set up our hospitals about a decade ago from Mysore. Now we have it in Mysore, Mandya, Bangalore and Tumkur. At Bangalore we have set up a higher tertiary or a quaternary care center which is in the fields of cardiac sciences, neurosciences, orthopedics, gastro, urology, medical oncology, etc. Now we have set up one of the finest facilities which has the best of equipments and also has a lot of patient safety features built in, along with a fantastic team who can deliver excellent results. In a simple sentence, I think at Vikram Bangalore we can do what is the safest and best for the patients, and if it can't be done here, it cannot be done elsewhere as easily. To enable us to give this cure in epilepsy, we have one of the finest set of team as well as equipments to deliver in a hospital which is very friendly, staff who are very friendly, setup which is very unhospital-like, so that the patients feel at home and recover quickly and go home. In the field of epilepsy, we have Dr. Raghavendra, who will now take you through how he will diagnose patients and how they are planned for surgery, and Dr. Ravi Mohan Rao will talk about how the surgeries are actually performed to give cure in epilepsy.
Hi, I am Dr. Raghavendra. I am the epileptologist in charge of the comprehensive epilepsy program at Vikram Hospital. As many of us are aware, there is a significant portion of the population who suffer from epilepsy, and about 20% of these patients do not respond to medicines, which is termed as medically refractory epilepsy. In Indian context, because of the wide population base we have, we expect about 5 lakh patients to be helped to certain extent or to great extent or even cured by a possible surgical approach. Thus, we have a significant portion of patients who are not offered the state of art of treatment. That's the surgical line of management for these patients. With this in the background, we have been able to achieve and develop a level 4 or the top of the end epilepsy surgical program at Vikram Hospital, Bengaluru. What we do here is bring those patients who are not responding to medicines and have significant disability because of epilepsy or side effects because of medicines, and subject them to various steps of investigations to make sure and to confirm that these patients are going to be benefited significantly by surgical approach. At the same time, we make sure these patients are not having any untoward side effects of a surgery. So the patients undergo video EEG, MRI, a functional MRI, at times a PET scan, and then a neuropsychological evaluation to see how the different portions of the brain are functioning, and then be assessed by an occupational therapist so as to have a comprehensive surgical plan to render and deliver a good surgical result to these patients. This is done by one of the most competent surgeon available who can deliver the various array of epilepsy surgeries here.
I am Ravi Mohan Rao, neurosurgeon at Vikram Hospital, Bengaluru, with a major interest in surgical treatment of epilepsy. Once the neurologist has diagnosed the patient has refractory epilepsy and tells me that the epilepsy, which is nothing but an electrical storm coming from a particular portion of the brain, and gives it to me, I proceed with surgery. The surgical options and solutions range from a simple removal of a focus which causes epilepsy in any one of the regions of the brain, to more sophisticated and complicated surgeries which involve larger regions of the brain according to the nature of the disease and the extent of the electrical abnormality. So the simplest surgery is a simple resection of a focal cortical dysplasia, for example, progressing to temporal lobectomy for temporal lobe epilepsy, and then later on multilobar resections and posterior quadrantotomies. Finally, the pinnacle is the hemispherotomy, where an entire hemisphere is disconnected for a diseased electrically abnormal hemisphere. I also do palliative surgeries like corpus callosotomies, which separate the two hemispheres and reduce the major seizure burden in the patient. We also do invasive intracranial electrode monitoring and also proceed to surgery once we have come to a reasonable conclusion. Finally, we also do responsive neurostimulation in the form of vagal nerve stimulation for treatment of medically refractory epilepsy, which cannot be cured with a surgical procedure. The results, because of the careful selection, have been excellent to date.